Thank you for coming. I think we're going to get started. Thank you for making it through the traffic. And thank you for joining us here to listen to what you need to know about tick-borne illnesses. So I am Krista Gannon, and I'm the chair of the Southwestern Vermont Regional Advisory Board here in the Deerfield Valley, which is a board of some folks who live here in the Deerfield Valley and hope to hear from you, be a liaison from you to the hospital, and then also from the hospital to you. So we like to bring you programs like this, and we like to help that interaction happen. So if you ever have any questions and you're wondering who to contact, you can start with me. I'll try to help you. But it's my pleasure tonight, then, to introduce our experts for tonight's discussion. So first, to my left, Dr. Trey Dobson is an emergency medicine physician, the Chief Medical Officer of Southwestern Vermont Healthcare, and Medical Director of Dartmouth-Hitchcock Putnam Physicians. Dr. Marie George, on my far left, is an infectious disease specialist at SVMC Infectious Disease, which is now part of the SVMC Multispecialty Practice. And in the middle of our experts here, Bradley Tompkin is an infectious disease epidemiologist at the Vermont Department of Health, where he leads the enteric, zoonotic, and vector-borne disease programs. So together, they're going to cover the full range of information about tick-borne illnesses and take questions at the end of the program. And with that, I hand the mic over to Dr. Dobson.
All right. Stop. Okay, so let's see. Is this about the right distance? Can everybody hear me okay? Okay, you tell me if I'm too loud or not. So we'll just start with this slide, which I think says it all. Ticks suck. And as you are likely aware, and you'll learn more about tonight, ticks are incredibly prevalent in our region. That's why we're here. And the diseases that they transmit actually cause a significant amount of morbidity to our area. And actually, I've already spoken with several of you in the audience. Many of you are either have family or yourselves have been a victim of tick-borne illness, and that's why you're here tonight. But it's real. It's receiving high attention from the medical community, from the patient community, others in healthcare, and then actually the government, because it costs a lot of money. So they're trying to figure out how to curtail those costs. And that's why we're here. I mean, there's a media frenzy that's going on. You can't open a newspaper today, a periodical. You can't watch television without tons of reports on ticks, tick prevalence, tick-borne illness. And there's some good information out there. There's some information out there that's a little bit misleading. And we're here to provide awareness first, and then provide some clarity on what we know and what we don't know. So what we'll cover is, making sure my slides advance. So we'll start with, I'm just going to give you a very brief case introduction. Then Bradley will present the epidemiology of both ticks and then the diseases they cause and the vectors and the pathogens and what their epidemiology is. Dr. George, who's infectious disease, is going to review the prevention, diagnosis, and treatment. And if there's time remaining, I'll kind of briefly talk about some of the new research that's going on, of which these two are also very up to date on. And then we'll definitely save time for questions. And if there are questions that you're not comfortable answering here, or if we run out of time, you'll have our email addresses, you'll have our contact information, and we can go from there. And we don't know everything, so if there's questions that come up, we'll try to find out the answer later if we don't know right then. So I came here in 2005 from Virginia, and I'm just going to tell you about a typical presentation that I would see in the emergency department as an emergency physician. And I'm going to kind of present this as physicians do to each other when they give case reviews. So we'll start with what's called the chief complaint. Why is the patient there? And this patient is here because they have a fever and a big red mark. 2005, saw them all summer, all spring, summer, and fall in the emergency department. And this would be a typical patient, a young, healthy person who is an avid outdoors person. So in this particular one, I apologize, I keep having to turn around. So she's had fevers and some joint pains. She's got this red ovoid lesion that everyone here, I'm sure, is now very aware of. She describes herself as an outdoors person, and she has a dog. And she frequently has ticks. She lives in an endemic area for tick-borne illness, which in this case was Shaftesbury, Vermont. And she's otherwise well. She's got a fever when she presents to the emergency department. Her heart rate's a little high, but close to normal, and everything else is pretty normal. And she is presenting as someone who feels poorly, but she's not in need of immediate hospitalization. And this is the classic rash. So this is 2005. It happens today as well, but I'm going to show you what's changed a little bit in what we see from patients. So here's 2017. So I could do the same case, which occurs in 2017, but I'll give a little different twist on it. So this chief complaint is very general. My body hurts, which as a physician means you've got to really dig in and figure out what's going on with this person. This is pretty much a sedentary male who lives in the town of Bennington with fevers, headaches, muscle aches, malaise, his big toe hurts, he has a cough, his stomach hurts, a lot of symptoms going on. Describes himself as an office worker. So pretty much an indoors person who has other medical problems presenting with just a myriad of symptoms. And now we consider tick-borne illness in this because of the change in the demographics of what's occurring. So this person has a high fever. His heart rate is not that high. That's a typo. It's not 1,100. It's 110. Thought we changed that last time. I must have missed that. But this guy looks like he's sick, like he needs to be in the hospital. And so your differential diagnosis, in other words, what are the different things that a healthcare provider would be considering, is very broad here. You can imagine it's very broad. But in the right time of year and in the right location, then tick-borne illness is very high on our differential. Does not have to have that big ovoid lesion on their body. So at this time, I'll go ahead and turn over the mic to Bradley, and then we'll kind of talk about what's going on in our state with the epidemiology of tick-borne illness.
Thank you, Dr. Dobson. I might try to take this off, and so I can.
Good idea.
Can you all hear me? Okay, so I don't have to keep turning around. So, yeah, I'm not a clinician. These two, of course, are expert physicians. I'm the one non-physician up here, but I work at the health department on tick-borne disease surveillance, and so I just want to talk to you about what's going on in the state with some of the more common tick-borne diseases. So you can see from this list here, we think we have probably about 10, almost 10 tick-borne diseases present in the state. Some are incredibly rare, like Lawson virus and tularemia and spotted fever rickettsia. And then some are more common, like Lyme disease and anaplasmosis. Some of them are kind of new to us. They've only been recognized within the last couple of years, like Borrelia Miyamotoi. The ones that I'm going to talk about most tonight are the ones that are transmitted by one particular tick, sort of public enemy number one at the health department in my group, the black-legged tick. It's called Ixodes scapularis. It's the official Latin name, but we call it the black-legged tick. And so the reason why we're here tonight, the reason why we're talking about this is because just over the last 8 years, the number of tick-borne disease cases that are reported in Vermont has drastically increased. You can see in 2008, there were about 400 cases that would get reported to the health department. By last year, we were touching on 1,000 cases. And we know that not every case that actually happens out in the community gets reported. So this certainly doesn't capture every single case that's out there, but it does give us a sense of what the trend is, and this is not the kind of trend that we like to see at the health department. I think we're gonna hold questions to the end, is that correct? Ashley?
Yeah, that's
Okay.
fine. Thank you.
So this rise in tick-borne disease cases has really been driven by two diseases primarily. The first is Lyme disease. You can see in 1990, 27 years ago, when Lyme disease first became reportable in Vermont, meaning that healthcare providers were required to tell us when they had a case of Lyme disease, there were 13 cases in the state. And you can see over time the number has increased quite dramatically at some points, to the point where in 2013 we had close to 900 cases of Lyme disease. Now, there has certainly been greater awareness and more testing that has contributed to the number of cases that get reported to us, but that can't be the only explanation for this increase. Certainly, the disease is becoming more prevalent here in Vermont and in other parts of New England. And so from 2008 to 2016, we've seen an 89% increase in the number of Lyme disease cases. The second reason why this increase in tick-borne diseases has occurred in Vermont is a disease that I don't think as many people know about. Lyme disease certainly takes a lot of oxygen out of the room, but this is a disease that's becoming more common in Vermont. It's called Anaplasmosis. It's also transmitted by the black-legged tick. And you can see, 2008, we first started keeping track of that disease, and unlike the Lyme disease graph, where it was an up year, a down year, up year, down year, and the gradual trend was going up, this curve goes up each and every year. You just don't see that kind of thing in epidemiology that often. This is concerning to me as a public health official, particularly because over a third of people in Vermont who get anaplasmosis end up hospitalized with it. I'm certainly not going to stand up here and diminish the seriousness of Lyme disease, but as an acute illness in Vermont, very few people in Vermont actually get hospitalized, about 3%. For anaplasmosis to have over a third of the people hospitalized is alarming. And as for what's going to happen going forward, we can keep very good track of anaplasmosis on a pretty quick basis. We can't necessarily do that with Lyme disease, and we know so far in 2017 we've already exceeded last year's number. We're at 220 cases. We have 84 open investigations, so not every one of those is going to end up a case, but certainly this year we're going to set another unfortunate record for anaplasmosis cases here in Vermont. So just to give you a sense of how, since both of these diseases are increasing, how much more anaplasmosis is increasing rather than Lyme. So in 2008, 97% of the diseases that were reported to us that are tick-borne at the health department were Lyme disease. But anaplasmosis, the incidence has increased so much over the last 8 years that Lyme disease is down to 77%, and 21% of all the tick-borne illnesses that we see are now anaplasmosis. Obviously, tick-borne diseases are a seasonal risk, right? So ticks typically like to stay under the leaf litter, somewhere relatively moist and warm in the winter. So it's really important that Vermonters understand when the risks are so that you can take the proper steps to protect yourselves and your loved ones against some of these diseases. So we have a system here in the state where we monitor emergency room visits on a daily basis. We do it typically to look for outbreaks, or to look after 9/11, we were looking for potential bioterrorism events. But we can kind of flip that system on its head, and we can look at not tick-borne diseases, but we can look at ticks, tick encounters, people who come in and they just want a tick removed from them, or they're concerned about their health after having a tick bite. And when we do that, you can see that people in Vermont are going to emergency rooms at the exact time we would expect ticks to be out and active. So in January and February, the text is very small in the back there, the ticks are dormant. And so that blue line you see up there, there's very few people in Vermont going to the emergency room with tick-related issues because of course the ticks are dormant. But you see there's a big increase in April, May, and June, and that's when the nymphs are active. So ticks have like a 2-year life cycle, and nymphs are the smaller, sort of middle-aged, younger ticks that come out in April, May, and June in Vermont. And then after that, they come out, they get a blood meal, hopefully from a chipmunk or a deer, not a human. But once they get that blood meal, they then hunker down again, and they aren't out looking for a meal because they're taking that blood meal that they got over the spring, and they're using that to grow and molt into adults. And when they're done doing that, we see another spike here in Vermont in activity in October and November, because those adult ticks are coming out and they're looking for one more blood meal before the winter sets in. So this is our historic average from 2004 to 2016. You can see the 2 bumps, and then when we can use this to compare this year to what we've seen in the past, and you can see this is a particular busy year for tick-related emergency room visits across the state. And the pattern has basically maintained what we've seen in history. The important thing to note here is that, do we have a red dot, is we're seeing this spike. This is current as of just last week. So what we can see here, and this is great timing for this particular talk, because the ticks are starting to come out again. They've been dormant or quiet for the last month or 6 weeks, but they're gonna be busy again from now until probably Thanksgiving. So this is another period of time we really want Vermonters out admiring the leaves, or maybe raking up the leaves, to be taking the proper precautions to prevent themselves from getting bitten by a tick. So if we've got this seasonal trend in when the ticks are active and when people are going to the emergency room for tick-related reasons, we see a similar trend in when people actually get sick. So this is our curve for when Vermonters are starting to get sick with Lyme disease. So we always ask people, what's the date that you first started to feel sick? And there's a couple important things to note here. So despite the fact that ticks are largely dormant in the winter, you can see still that Vermonters do get sick in the colder months in very small numbers, but they do still get sick January, February, March, and December. If it happens to be a particularly warm day, there's no reason why a tick that didn't get a meal earlier in the season won't come out and try to get a meal at that particular time. But we also see that the period of time in Vermont where you're really at risk for Lyme disease are June and July. Now, Lyme disease has an incubation period, meaning that the minute that you get bitten is not when you're going to start feeling sick. It can take you anywhere from 3 days up to 30 days after your tick bite before you start feeling sick after a tick bite with Lyme disease. So actually, the period of time that people are most getting exposed to ticks that are carrying Lyme disease is probably in May and June in Vermont. So next spring, when you're starting to garden or you're cleaning up your yard, we want people to be thinking about tick-borne disease and preventing tick bites, because that's a period of time when most Vermonters are at risk for Lyme disease. Now, if we contrast that with anaplasmosis, you see something similar, very few cases in the winter and more cases in May and June, some in July, just like we would see with Lyme. But unlike Lyme, we see this second spike right here in October and November. So if you remember a few slides back, we've got this bump here when ticks are out. These are adult ticks. So while we're not going to see a lot of Lyme disease cases occurring in Vermont in October and November, we know now that this period of time, the fall, is when people are at particular risk for anaplasmosis. Now, who's at risk in Vermont? We know when people are at risk for these diseases now. Let's talk about who is at risk. So this is the ages in 5-year increments from 0 all the way to 85 plus for who gets Lyme disease in Vermont. And there's 2 important things to note here, is that 1, we've got orange bars from the very young to the old. So everybody in Vermont is at risk for getting Lyme disease. okay? But we do also see that there do appear to be two high-risk groups. One would be kids between the ages of 5 and 14 years of age, and then the risk drops down in the teen and early 20s, and it starts to increase again when you get into your 50s, 60s, and 70s. So people who are in those age groups are at particularly high risk in Vermont for Lyme disease. If we contrast that again with the second most common tick-borne disease, Anaplasmosis, you see a very different pattern. You see very few people in Vermont who are young get anaplasmosis or have it reported to the health department. It certainly happens. It's not impossible, but there's very low numbers. But as we get older in age, starting in your 40s, we start to see increased risk for people getting anaplasmosis in Vermont. So right now, this time of year, people who are 40 years or older, I'm in that group now, in Vermont are at particularly high risk for anaplasmosis. So pay particular attention to what Dr. George is going to talk about in her prevention section. Some of the other diseases that are caused by black-legged ticks that we know are here in Vermont are babesiosis. This is the one tick-borne disease in the state that we have that is caused by a parasite. Anaplasmosis and Lyme are both caused by a bacteria. This one's caused by one that visually, at least, if you look at a blood smear under a microscope, looks like malaria. It's not malaria, but it looks like it. We know that the risk is particularly high in southern Vermont. Half of all the cases that we've had are in Bennington and Rutland counties. Borrelia Miyamotoi, this is a disease that was first discovered in 1995. We had our first cases in the United States, in New Jersey in 2013, and now we have it in Vermont. We recognized the first cases in 2016, and this slide is actually a little bit out of date. We have about 20 cases now that have been recorded here in Vermont, again transmitted by the black-legged tick. And the last one is Lawson virus disease. This is something that's gotten a lot of attention this year because of some publications that came out in the spring about a little child in Connecticut who unfortunately came down with Lawson, thankfully survived. We know that this disease is present here in Vermont, but it's rare. We haven't had a case since 1999. We could spend the rest of the evening talking about why we've seen this increase in tick-borne diseases, but I think one of the most important things we have to sort of understand and grapple with is that human habitat is tick habitat. So while we're talking about these diseases as tick-borne diseases, they're at their very essence zoonotic diseases. The reservoirs for these diseases are actually animals that we have out in nature. The white-footed mouse, the eastern chipmunk, the mast, and the short-tailed shrew, and to a lesser extent, the white-tailed deer. These are all animals that can maintain Lyme disease and anaplasmosis in their bloodstream and allow a tick that doesn't carry these pathogens to pick it up and then go on and transmit it to somebody else. And of course, we've modified our habitat, our living arrangements, to such a degree that it's actually good habitat for a lot of these creatures. And that's probably played a pretty significant role in why we've seen the increase in these tick-borne diseases, not only here, but in other parts of New England. And not to get too depressing with my last couple of slides, but so far we've talked about just diseases caused by the black-legged tick. This is the Lone Star tick, and this map here in the light tan, the area where the tick, its geographic range used to be, you see it could go as far north really as Kentucky and Missouri. But over the last couple of decades, this tick has spread further north, all the way up into upstate New York and Maine. Vermont is conspicuously gray on here, though I don't necessarily believe that's the case. So this is another tick that's moving, creeping up into our part of the country. And it causes a couple of different diseases. It can transmit ehrlichiosis, tularemia, and then also Heartland virus disease, which we're not necessarily sure we have here. We've never had a case of it, and it's only been discovered in humans down in the south. But we know that our cervids, our moose, and our deer carry this or have antibodies to this disease. So we have some clues to think that maybe this disease is lurking here in nature as well. And if we look to see where there are cases of ehrlichiosis in Vermont, we can see that there are a few spots, particularly in Rutland County, where this disease has popped up, and when we interview the people, we know that they didn't leave Vermont or they didn't leave their county in the period of time when they were likely exposed to this. So we think that this tick is here in Vermont as well. So now I'm going to turn it over to Dr. George, and she's going to talk to you more about these diseases.
Thanks, Bradley. Give me a minute because I'm going to need a second to get organized. If any of you know me, which some of you do. Happy to have you here. So let me move on to kind of the practical aspects of tick-borne illness. So I'm starting with kind of recognizing tick bites and preventing tick bites, which I end up giving this sort of mini lecture probably 5 times a day in my clinic, every day in tick season and beyond. I never tire of giving it, but it's just amazing at the end of the day how many times we have to do it because folks come in with so many tick-borne illnesses. So everyone could be tick smart, and you've seen there's plenty of reading material, but it's actually very practical. Ticks are, when you hear about nymphs and adult ticks, the point is that these are, the ticks that transmit illness are right down from the larvae side, right from the very first time they are emerged till adults. So every stage of a tick can transmit an illness, and the newest one that Bradley talked about, Borrelia Miyamotoi, is actually transmitted by a larvae tick, which is so tiny, it is literally a pencil dot on your body. So don't actually be sure that you're going to find ticks. I have lots of patients that come and say, oh, I look for ticks all the time. Don't worry, I know if I can find them. Well, sorry. Ticks are active even in the winter. You've seen some slides to report to you about that. And in fact, I see disease all the way through the winter, even though there are smaller numbers. They do use rodents as the white-footed mice to be their primary vector, and because of that, that's why they're so widely dispersed. Other mammals, of course, but the white-footed mice are everywhere, and everywhere in Vermont, and so that is why it is so prevalent. Deer ticks are the kind of tick, the black-legged tick and a deer tick are the same, when we use that interchangeably. So deers have gotten a bad rap, but the black-legged tick is really the tick that transmits Lyme, Anaplasma, babesiosis, Borrelia Miyamotoi, and Lawson virus. And those, as we said, they're very small, and for most tick-borne diseases, 24 hours is the time period that we believe that they should be on your skin and engorged with your blood, but we know now that some of the other illnesses besides Lyme disease can be transmitted in a number in less than 2 hours. So having an engorged tick is not necessary. Here are some relative sizes of the black-legged tick versus the dog tick. So a black-legged tick is is relatively smaller, although once they're engorged, they don't look particularly smaller. But the dog tick has a conspicuous sort of white ring. It's not the white dot of the Lone Star tick, but that sort of white ring, so that's that bottom. Let me use my pointer. Try to use my pointer. This is the pointer, right?
Top one, yeah,
Top?
you got it.
Is it backwards?
No, there it is.
Yeah.
So there's the dog tick, and that is an adult dog tick versus an adult black-legged tick, and you know there is a difference in size and there's a difference in markings. All my patients tell me they barely ever see dog ticks anymore. Here's, you know, again to reinforce the size of ticks, they basically look like a dot. And I don't know if you can see the hand. That's a larvae. And those are larvae and adults. They're really teeny. So in order to prevent tick bites, you have to, you know, just be very convinced that you may or may not see them. And so really the message is that you have to protect yourselves, protect your home and protect your yard as best you can for prevention. So prevention is going to be kind of the high, you know, point of all the rest of this lecture. So avoiding contact by walking, you know, staying clear of high grass areas, high leaf litter areas, walking the center of trails are logical things. There's a great picture about a tick that's on the blade of grass reaching for people, and in fact they are. They're trying to do whatever they can to get their blood meal. Using repellents are really important. So using at least 20% DEET on your skin, or using Skin So Soft, which I believe is that picaridin, or other commercial repellents do work. And I do find that people are not excited about using repellents, but if you really, you know, believe that there is the risk of tick-borne illness and how serious they can be, you'll do it. I'm often asked about the natural oils, and sometimes I find people believe that they work, and I shouldn't say believe. They may work. There are several out there. I've had mixed reports from my patients about those. You know, you should apply them with good instructions. You should, you know, you can put DEET on children, but definitely avoid their scalp, their hands, eyes, and mouths, and you use less than 20% DEET on children. There is a website that can help you find insect repellents. It's a lovely website that has everything you want to know about an insect repellent, including its percentage of DEET, and it's EPA.gov, and you probably can Google it that way. The primary repellent, though, isn't so much for your skin as it is for your clothes. And I believe that everybody can manage, you know, protecting their clothes. Permethrin is a highly effective repellent and actually kills ticks on contact. And there's reams of research right now that supports the use of permethrin on your clothes. There are definitely lots of types of permethrin. They're all, you know, they all have enough concentration. I end up recommending Sawyer's just because there are aerosol, non-aerosol. There's lots of different types of it, whatever you prefer. It is, though, very important to not just say, oh, I forgot to do my clothes, and, you know, spray it a little bit and run out. It's important to treat your clothes fully. And the way you do that is to take, I think we have a picture of that. Let's see if I can get to that. Here it is. It's important to use either a tarp or a hanger. Put your clothes in an area that's well ventilated but not blowing, so not out of doors. Spray your clothes until they're wet with the permethrin and let it dry. And then it is impregnated and will last through like 5 washings. So I tell my patients all the time, you know, designate your gardening clothes, your hunting clothes, your raking clothes, and spray those and really protect those. Or if you're going, you know, on a trip, do everything in your suitcase, and you know, and then you're set. It really is just a little bit of investment to get a lot of protection. I do include, so, you know, here are the facts about permethrin. They won't stain your clothing. They're very safe. They do kill ticks, and they do stay effective on your clothing for several weeks. I also include this slide from the #1 entomologist in New England. and because everyone, really feels like, how can something so strong be safe? So going through permethrin facts is that it is very toxic to ticks, about 2,200 times more toxic to ticks than humans. The EPA reports that their permethrin-treated clothing poses no harm to infants or children, and even if it's put directly on the skin, the absorption is less than 1%. The exposure risk of permethrin-treated clothing to toddlers is 27 times below the EPA level of concern, and a 140-pound person would have no adverse health effects if exposed to 32 grams of permethrin every day. And there's less than 1 gram in 1 container of spray. So I hope that gives a perspective of this is highly effective without toxicity. Okay. It is also important to find ticks before they attach. So, removing your clothes in your mudroom and going in the shower, makes perfect sense. And having someone do a tick check makes perfect sense. Dr. Michl wrote these slides, they're quite good. He talks about that, putting your clothes in a dryer, a high heat dryer is very effective for killing ticks. So they have to be in the dryer for 10 minutes after you come out from indoors, and if they're damp, they should be in the dryer for about 60 minutes on high heat. They're tough. That's why you have to do it so long. It's very, very helpful to bathe or shower after coming indoors, and then the tick check. So it's very, very important to do a tick check because ticks are really looking for those dark, moist, non-noticeable places. They seem to be highly smart in that they are looking for places that you're not going to look. So it's the groin, it's the underneath of the backside of the buttocks, it's behind your knee, it's behind your shoulder blade, and nowadays it's so weird. So many more in the scalp of both children and adults. So it's very, very important to be looking everywhere for ticks, particularly in children in their groin, and their belly buttons, and their hair. Protecting your yard is also very important, and I often tell people that if they, want to keep gardening and they don't, I have folks that say, I'm never going in my garden again, and that makes me sad. So there are ways to create a physical barrier around your yard. Wood chips or gravel, even though ticks, travel on mice, they don't seem to want to cross a gravel or wood chip kind of barrier. So making one that separates the woods or the high grass from your low grass, that is a barrier of wood chips, is highly effective. Keeping your grass mowed short is also effective. Not perfect, but effective. Always be careful of the wood pile. A moist wood pile where mice are living is a primary, focus of where ticks live during the winter. So if you go out and take your wood and put it up against your body, you're carrying ticks in, during the fall and winter. If those clothes are covered in permethrin, then you're helping. Other suggestions of keeping, equipment, decks, and other things away from, trash and long grass is highly, it's really very helpful. Tick tubes are a great thing. I'm just going to tell you my version of tick tubes. So tick tubes, we talk about every day in my office. You don't have to buy them on Amazon. You just have to save your empty toilet paper tubes and get a bag of cotton balls. And then take permethrin spray, the same spray that you use on your clothes, and spray the bag full of cotton balls with the permethrin and let it dry. Then take 5 or 6 and put into the toilet paper tubes and drop them every 15 feet on the perimeter of your yard. If you have a huge yard, maybe you can't do all of it, but maybe you make what you call a virtual safe zone. That material, though, will be taken up by white-footed mice. They'll use that cotton in their nests, and in fact, If you do it in May, I added on April, May, and September. Actually doing it 3 times a year is really the sort of most focused way to do it. And what happens is that when that material is in a mouse's nest, the ticks that come in to try to live on the baby mice actually die. So it really works. There's been studies that have shown that you can decrease the local amount of ticks by 70 to 90% by using tick tubes. Okay, dealing with a tick bite. So this is that's a scary looking. So there's a typical tick bite, and later on I'm going to talk a little bit about the a tick bite reaction, but this is a good example of a small reaction to a tick bite. This is not Lyme disease. This is really just the local reaction to the tick. But a tick puts its head into your body to get its blood meal, and in order to remove it, what's important is to grab it with intensity and pull it out. So the easiest way is to use pointy tweezers. Don't try to burn it out or use gasoline or Vaseline or any of those things. Just try to pull it. Grasp it close to the skin and pull it straight up. You shouldn't be increasing the likelihood of infection if you get close and pull it out. And don't worry about the mouth parts of the tick. Even if you see little bits of dark or mouth parts or head parts still there, don't worry and don't try to dig them out. The dermatologists tell us they see more infections that come from digging out the ticks than tick bite problems. You can save the tick to show it to your doctor to help you identify that it's a black-legged tick. It almost always is. But the state lab no longer tests for ticks or the infections inside of ticks unless they're doing their own study. Right, Bradley?
Correct.
And you can, after you pull out a tick, it's perfectly fine to put bacitracin or alcohol to clean the area. Okay, so here's bite reaction versus a Lyme rash. These are both rashes of Lyme. The key points here is that a bite rash, the bite reaction starts right away, and people definitely worry that they've gotten Lyme in the first couple of hours, but it usually is not so. A bite reaction is always smaller than 2 inches or 5 centimeters, and a Lyme rash will grow over several days and become larger than 2 inches or 5 centimeters. And it's reasonable to not panic, but to actually watch a rash and if it does grow over a series of days, it's important to call your doctor. The bite reaction, of course, usually does not have the other symptoms. So the other symptoms that you heard about when Trey gave you the typical case of headache and feeling feverish and malaise and feeling dizzy and having a flu-like kind of muscle ache. That's all typical of all of these illnesses, and we'll go into that. But a bite reaction, usually you feel well. The diagnosis of Lyme disease this can get a little complicated, but I always find people that want to know. So, briefly, what we use and what is highly effective is to use Lyme, your body's response to Lyme. So we can't right now tell you that you've had Lyme today by a blood test. We can certainly do it very effectively by knowing what a Lyme illness is like, and doctors are very, very good at that right now. But what we can do is get clues about Lyme by using antibodies, and this is a busy slide that tells you that there's early antibodies, ones that rise in your body very quickly, and there's some that rise later. It's the combination of antibodies that helps us know whether you've had Lyme disease now, whether you've had it in the past. And we have an excellent lab that helps us with that. The Western blot people hear about and talk about and ask for, but remember it's only done as a second confirmatory test. And what a Western blot is a test of very specific antibodies, that your body's response to the infection. And we only use the IgG, the late antibody blots, to help us with a diagnosis. And that's very brief of a more complicated thing. But people always want to see their blood results, so I thought I'd put one up for you. So this is a typical panel of tick-borne illness, and we are very lucky in our hospital because we can test, because there's so many overlapping symptoms between all the tick-borne illnesses, we're able to test for all of them in one panel. And when we test, you can see those names that you've been hearing: Babesia, Anaplasma, Borrelia Miyamotoi, and Lyme. And when this particular person does not have Babesia, does not have Anaplasma, does not have Borrelia, but there's those strong antibodies, 3.5, 2.3, those are all strong antibodies of Lyme disease. And that says positive. I don't know why that's not, oh, here it is, okay, right there. Okay, it's also important to know that our laboratory stores blood. So if you've ever been tested for Lyme before, they get to compare your old results with your new results. And for folks that have thought about and worried about old Lyme and new Lyme and chronic Lyme and is this, do I actually have Lyme this time or not? It's very, very helpful because our laboratory can differentiate old from new in very effective ways. It's important to also have this slide, which says there needs to be caution. This first was put out by the CDC in 2005, and it's still true today, that there are many laboratories that test for Lyme disease, some of which are not FDA approved and are not recommended to be used. And they test various things: urine, skin snips, and other things that have not been fully vetted through the scientific research process. So this is, it's very, very important when I'm faced with the question of this test came from a lab that has not been fully FDA approved, then it becomes really hard to know whether they're accurate results. So the diagnosis of the other tick-borne illnesses is sort of interesting because even though Lyme disease, I told you that you can only use your body's response, right? That thing called antibody. Well, the other tick-borne illnesses, we can tell you today, this minute, whether you have that infection, if you get infected, because we can test what's called their DNA. So now everybody, when you hear PCR in the world, right? You can know what PCR is. It's a way of, oh dear. Well, I'm going to hope. Well, anyway, Anaplasma, Babesia, and Borrelia Miyamotoi all can be told, we can tell you whether you've had that infection acutely by PCR. We also can tell you afterwards about your blood response, and sometimes we can see those infections on a slide. As Bradley was alluding to, that Babesia can look like malaria. And the testing for our most feared infection, Lawson virus, is still very specialized and done at the CDC on a case-by-case basis. I'm often asked whether a person can get more than one tick-borne illness from one tick bite. Indeed, you can. And ticks can carry more than one illness, and I have seen patients this season with both Lyme and Anaplasma, with Anaplasma and Babesiosis, and with Lyme and Borrelia Miyamotoi at the same time, and they are sick. Treatment is kind of a, I just wanted to reassure you that treatment is fairly straightforward for these infections. They are mostly bacterial infections, and they respond to a good old doxycycline, which luckily for us is still relatively inexpensive and very effective for almost all of the tick-borne illnesses, with the exception of babesiosis, which takes a completely different kind of treatment. And remember, Lawson virus is a virus, and it has no antiviral medicine. The treatments are doxycycline for anybody over the age of 8, for Lyme disease, for anaplasma at any age. So I do get that question, but at any age, anaplasma you can treat with doxycycline, and there are other options. What is important to know is that after your infection and your prescription are gone, you can get any one of these infections again. You are not immune. So if you get bit again, and I've seen maybe 5 patients this season who got 2 tick-borne illnesses in one season. Just one week after finishing his treatment, he got anaplasma a second time. It was unbelievable. Anyway. So it is important to know that treatment of Lyme disease, that prolonged antibiotics do not actually result in better outcomes. I put in a few studies here that in large studies with lots of patients, 180 patients, 607 patients, I reassure you that whether you're treated short or long for Lyme disease, you still have very good outcome after months. And the largest study after standard treatment with additional amoxicillin for 100 days, there was no additional improvement than just using a fake sugar pill. So probably feeling better when using antibiotics over and over, or you feel like you've relapsed and you feel like you need more antibiotics, is probably the so-called anti-inflammatory response of antibiotics. Antibiotics actually make you feel better because they act like Motrin, they act like ibuprofen and Tylenol. They have that effect that can make your body feel better without doing anything for the infection. So I get a question, what happens if I still don't feel well after tick-borne illness? Remember, it is completely curable. Lyme and the others, it's not secretly hidden most of the time or persistent or flares if you've been treated. Many people have symptoms after they finish treatment. It can be up to 50% depending on the study. That you often feel fatigue, you feel pain in your muscles, you feel like you are unable to focus, that you have low energy. I would just reassure you that this is not, the infection isn't treated, it is probably the post-Lyme symptoms. It does appear that people who have had very severe symptoms when they present, or if they have that rash that in multiple spots around their body, or if they had a delay before they were treated, they are more at risk for prolonged symptoms. And it is, important to ask, if you feel worse after being treated, is there a second infection? We have diagnosed 2 infections at the same time because the babesiosis was not treated. And is the infection exacerbating something else in your body, such as an arthritic condition? I do this all day, every day. I talk to people about how you're going to get better from Lyme disease. If you get anaplasmosis and Borrelia Miyamotoi, you feel better in like 2 days. You get your antibiotics and you feel completely well. With Lyme disease, often you feel better, then you plateau. Then you feel better again, then you plateau. Don't get nervous during those plateau periods. People just need to know that that's how you get better. It is not linear, it is stepwise. And that stepwise, don't worry, you will get better. You can use graded exercise, the knowledge that you'll be better, and there are medications for depression and nerve pain that can really help. There is a syndrome called post-Lyme disease syndrome, which is very important to recognize. It is symptoms that persist for more than 6 months after getting treated for Lyme, and it can be evident in up to 20% of people. It is probably due to inflammation in your body that we're still learning about. There are elevated inflammation proteins in your body that are pointing to the people that have post-Lyme disease syndrome, and we know it exists, but it doesn't need antibiotics. It needs often time and other treatments to help get all the way better. And lastly, there is an important late Lyme arthritis that's called antibiotic refractory late Lyme arthritis, where some people actually can have inflammation in their joints after 2 to 3 courses of antibiotics. It is usually not an infection, but there is a immune arthritis that it happens. So we're still learning a lot about what Lyme can do and what its post-reactions are. And I think we are on to future research. Thanks.
Thanks so much. So I'll just do one slide here, and it's getting late. But I think the theme that you can see is it's a different time. All of these things that Marie was talking about, Dr. George, doing in your yard, doing to your clothes, it's a different time. We didn't need to do it 25 years ago, and times have changed. And if you don't do it, my family's been stubborn about it too, and my child developed anaplasmosis. Fortunately, he was totally fine. But now we stick with Marie's recommendations 100% of the time. Just real quick, just a little something to get excited about, because this is also dismal, right? And so let's just talk about some exciting things. There's a lot of research out there. Most of it is directed at Lyme disease, and probably for good reason. As Marie was saying, the other diseases tend to respond really well to antibiotics. Lyme responds really well to antibiotics too. It's a little bit harder to diagnose, and often you can have these lingering symptoms that that are definitely out there, and as much as 10 to 20%. So that's where the research is focused. A lot of drug trials looking at different drug options. Some people don't tolerate the medications that we prescribe for Lyme disease. And then also testing, trying to improve that testing. Dr. George talked about how we can use the DNA fingerprints of some of these diseases to detect them very quickly in the blood. Maybe not right that second, as she said, but within an hour that the lab can run the test. But Lyme is a little different. So a lot of focus is on the testing. You've heard about the vaccines. There was a vaccine that was available for a short time period. It was pulled from the market, probably due to some reported side effects, but there's also some other variables in why it was pulled. But the good news is if you're a dog, you can get vaccine to Lyme, so you don't have to worry about it too much. One of the more exciting things is the monoclonal antibodies, and I'm certainly not an expert on this, but I'll just tell you briefly about how it works. It's basically taking a drug that is an antibody, in other words, a protein that as soon it's circulating your blood, and as soon as it encounters, for example, the bacteria that causes Lyme, it'll engulf it so that it can't be infectious, and your body gets rid of it. And the exciting thing about it is that you'd probably take it once or maybe twice a year, and that's it. So it'll give you about a 6-month protection. And it is possible that we see that in 2018 because they're moving fast with the trials. But I've been around medicine long enough to know I don't believe it till it actually comes out on the market, and hopefully it doesn't cost $1,000, and we'll all be able to afford it. And then last, back to what Bradley was talking about, it's focusing on the other aspects, which is actually how do we control in the appropriate way the mouse populations, the deer populations that sort of separate their habitat from where we like to be. So that's it. It's getting late. We could keep talking about any of these particular topics for a long time, but let's just open it up to some questions.
Can testing for the disease be done in our health center, or do they have to go to Bennington?
Well, Marie can talk about that.
Certainly. Dasha's here. Absolutely. I mean, it does. That the blood does travel from here to Bennington, and then it actually goes to Norwood, Mass. So it's picked up almost every day. So it is a quick turnaround. If we want it instantaneously, yes, but we don't have that yet. Yeah.
And we didn't get in this tonight because we had probably 70 slide decks, but we don't wait to treat just based on the test, depending on what presents. And in fact, Bradley kept pointing out reported cases. There's a lot of cases that we see that aren't reported because we just make a diagnosis without doing testing and stuff. He doesn't like to hear that, but that is the case.
No, you know what? My slide somehow.
Oh, you had some slides on that? Well, we went through it too fast. So when someone presents with an obvious disease, then you treat. When they present in the middle, you may treat and test. And then if they present where I don't think this is Lyme, or sorry, I don't think this is tick-borne illness, but we want to cover the gamut, then you might test and hold on the treatment because a lot of those will end up being negative.
Right, I'm really sorry, but somehow the most important slide.
I think I saw you flip through it real
I
quick.
went right through it. I'm so sorry. But we can go over that.
Yes, go ahead.
Can you discuss how often or can the results of the ELISA test might be a false negative?
Sure, and it also depends on the time of presentation. I'll give that to you.
Well, a false negative for Lyme happens a lot. It takes about 2 to 4 weeks for the antibodies, remember, to come up. So remember in Lyme, we're only testing right now for your body's response. So that can take 2 to 4 weeks. So that can be falsely negative. So the point is that diagnosis, clinical diagnosis is the most important thing. Your physicians will see you and know that that constellation of symptoms is highly suggestive of Lyme and may definitely start treatment. But how often, in this community, it's, I guess I don't have that number, but yeah.
It's hard, it depends.
But those other infections, Anaplasma and Babesia and Borrelia Miyamotoi, they're very small number of false negatives. So if you're told that you don't have a positive result for them, then I would, then there's no delay. Yeah. Yes.
If you're given a blood test, if you're relying on a blood test to get the result, positive or negative, but the spirochete has migrated from the blood into the deep tissues or into the synovial fluid or something, so you get a negative. Maybe you get some symptoms later, and you come back for a test, and then if it's appropriate, you give cerebrospinal fluid or synovial fluid or something. And then you say, well, okay, now it looks like we got a positive test, we're going to give you some antibiotics, but maybe a month or 6 weeks or 8 weeks has gone by. How effective, well, number one, is that a problem? Or number two, if you start giving antibiotics at that point, how effective are the antibiotics if the spirochete now is in the deep tissues?
Well, the antibiotics.
You might want to repeat the question.
Yeah.
So that people
Did everyone hear that question about whether, if a physician, saw a patient and didn't recognize that they had Lyme disease early on, and then the bacteria, the infection would go quiet and can then be found in joint fluid or sometimes in the brain or in spinal fluid, the eye, the heart. Those are all the stages of Lyme disease that happen if the early stage is not treated. So that's why it's, we focus on diagnosing and treating early. That being said, we have great success, complete success treating later when we treat joints, when we treat the spinal fluid, when we treat the heart. We have very good response. We have, except for those rare cases that I told you about, but those antibiotic resistant refractory arthritis, the antibiotics are very, very good at penetrating all those tissues.
Right.
And cure.
Yeah. But I do think your point is correct because it goes back to what Marie was saying. The longer the diagnosis and the treatment does seem to correlate with a few percentage of people having the post-Lyme syndrome. But,
Yeah. That's why we generally don't wait for the test.
yeah, that's
The
exactly
test
right.
is delayed and, we can recognize the infection. Does that make sense? Or I'm sorry that that's the most important slide, sorry. Yeah.
Correct me if I'm wrong then, but I thought that one of the reasons that antibiotics wasn't effective all the time is because there were certain places the spirochete could go in the body where the antibiotic couldn't. Is that?
No, I'm afraid that isn't so.
Okay, thanks.
Yeah. But that is out there. People talk about that. But that's not our experience. That's not, Any other questions?
Well, go ahead.
Is there any correlation from weather to number of ticks? I mean, a warmer or wetter summer or lack of snow in the winter?
Thank you. Yeah, thank you for the question. Great question. So there is, but it's not necessarily cut and dry. So if we had a lot of snow in the winter and it was cold, the snow is actually going to provide insulation for the ticks, so there wouldn't be a lot of ticks dying because of the snowpack insulating them. If it's very cold and there isn't a lot of snow, that can kill a lot of ticks that are trying to overwinter. In excuse me, in the spring and summer, ticks, they like warm, moist weather. So if we do go through a particular dry spell, then the ticks are going to stay relatively inactive because they're going to desiccate pretty quickly when they're on that edge of the blade of grass waiting for you to come by so they can get you. So there is a correlation, it's just not necessarily cut and dry.
Is there a correlation too with the mass crop? They say if there's a good mass crop, it's more food for the mice, so the year after a good mass crop, you're going to have a good tick infection.
Yeah, that's certainly the case, particularly true in New York, where they've got their forests are dominated by oak. So you're correct, there's a big mast year. That means the following year is really good. There's a lot of mice, and then the year after that, there is a lot of Lyme disease in the mouse population and a lot of Lyme disease cases. Up here, it's a little bit different because I think we're primarily a beech state and maple, but yeah, we do see ebbs and flows as well. That's true.
Yes, sir.
I've heard it recommended that a 1 or 2 day dose of doxycycline right after you're bitten by a tick will prevent these diseases. Is that not recommended?
No, so I'll speak briefly and then Marie can chime in, but there has been one study that was pretty well powered, in other words, large enough to make an inference from, that noted if you were bitten by a tick that had been, there were certain criteria, it had been on the body for 36 in the study, that a one-time dose of 200 milligrams of doxycycline decreased the incidence about in half. Now, there haven't been many follow-up studies on that, and there haven't been any studies in the other tick-borne illnesses, but most people use that to treat with a one-time dose of the doxycycline. So that's correct.
Okay. Thank you.
All right, well, thank you everyone for
Thanks,
coming in.
everybody.
Actually, we'll have